Welcome to the Terror Rule Podcast, your favorite accidental podcast. Today's guest is Dr. David Antonyan, and we're going to be discussing binocular vision dysfunction, which Dr. Antonyan believes is a hidden epidemic in the United States that is causing so many debilitating symptoms, everything from anxiety to exacerbating symptoms of being neurodivergent, panic disorder, migraines, cluster headaches, chronic pain in the neck, so many things. We're gonna learn everything there is to know about a condition I was recently diagnosed with, binocular vision dysfunction. Terror Rule Podcast, where inevitably every content creator has a podcast for at least a few weeks. So episode 3. We're talking to Dr. David, and I call you Dr. David because I honestly don't know how to pronounce your last name. So if you could, how do you pronounce it?
Sure. Antonyan, Dr. Antonyan.
I was right. Okay. I didn't want to butcher it. Okay.
No, it's fine. Dr. Antonyan is fine.
Okay.
Or Dr. David's fine.
The topic is binocular vision dysfunction. And I guess I'm going to put on my glasses here because these are freaking life-changing. Not even joking. So we have Dr. David Antonyan, and he is a binocular vision dysfunction specialist. And I did not know about binocular vision dysfunction until I actually saw one of your TikToks a while ago, and it was about being at the grocery store. And it was so spot on to what I had been dealing with that I was like, okay, I need to look into this. And then I saw the one about driving. And I was like, okay, this is really interesting. How did you first find out about this condition? Because I also want to talk about how you said you think it's kind of like an epidemic that isn't well known about.
Yes. So, let me start off by saying I have this condition myself. So I know firsthand experience of the symptoms that people go through on a day-to-day basis in different parts of their lives during different activities and the type of changes it can create in people. So experienced it firsthand. I've been to many different doctors myself growing up as a child, and every single doctor said your eyes are perfectly fine, they're healthy, you got 20/20 vision, there's nothing wrong with them. And either they prescribe reading glasses or nothing at all. And day to day I kept just noticing that I'm anxious, I'm uncomfortable, I'm not confident, I have a hard time bringing things into focus every time I'm reading something. I have a hard time keeping eye contact with people. I feel uncomfortable in very noisy type of places, anxious, and you just want to stay home away from people. You want to isolate. You just want as much of a comfortable setting as possible. But of course, life, we have to go to school, we have to go to classes. I used to go to many different activities, and it affected every single one of my activities. Piano, I used to go to gymnastics, I used to go to karate, and it affected every single one of those. So you realize there's got to be something up, and going through life, just learning to compensate. Most of us are compensating. So I strongly believe majority of the population has this issue, and majority of us are compensating. And some of us that can't compensate have the symptoms, and they get mistreated, misdiagnosed, medications that not only do not help, but they make the condition worse, and it just gets worse and worse. So yeah, I somehow figured out that I have this myself right before graduation. I had a little 8-year-old patient who we're doing these testings on, and she was like, yeah, I skip lines when I read. It's hard for me to stay focused on task, and I'm kind of clumsy. I'm like, what the hell? That sounds like me. So, right after finished the exam with her, I went and did the same exact test on myself, and I'm like, oh my God, why is my one eye jumping higher? Something that I played around with as a kid. Just when you're laying down, you're like, this is weird, right? So, and then once I figured out the amount I should prescribe with the help of a binocular vision specialist there, and I started wearing these glasses, my life changed completely. And it just got better, and things got easier, and I became more confident. I'm like, what is going on? So I started learning more and more about it, and I became obsessed over time. And then I started risking it on my patients and catching it and risking it, and that's how you get better at it, experience. And now I'm spreading awareness because I'm catching it left and right. I'm seeing it in celebrities. I'm seeing it in people. I'm seeing it on people on TikTok talking about other conditions that they've been diagnosed with. And I'm like, BVD sounds more like BVD than anything else.
Mhm.
But that's why I'm here, because I think a lot of people are suffering from this.
Yeah, I know that some people in the chat are asking specifically about what are some of the symptoms. So I'm gonna give my personal symptoms first, and then if you want to fill in with anything I missed, because I didn't used to have this problem. Maybe a little bit, to a point that I didn't notice. However, growing up, I never had issues with my attention span. I loved to read. As soon as I could drive, I loved to drive. I would just go on long drives every day. I loved going to the movies. I loved hiking. I loved doing all of these adventurous things. And, as I got older, I realized I wasn't reading as much.
Mhm.
My ADHD, I don't know if I developed ADHD, maybe. ADHD became a huge issue for me, especially with reading, paying attention to things. My executive dysfunction got out of control. Like, I could not make any decisions on what I wanted to do. And again, I do have ADHD, but this condition seemed to exacerbate, especially the executive dysfunction component. I wasn't going to the movies, and I really noticed a few years ago, there was literally one day I was looking at something with text on it, and it was like a piece of paper, and I like went like this to try to like catch the letters falling off the page, is the best way I could describe it. They like jumped.
Wow.
And all of a sudden I was like, oh, everything looks kind of weird. And I noticed that one of my eyes, I took a video of myself because I noticed my vision got funny all of a sudden. And I noticed one of my eyes was pointing in a different direction. And I showed it to an eye doctor, and they're like, that's fine. Don't worry about it. Your vision is almost 20/20. So as the years have gone on, I have, I have some trauma, and I started going to therapy again for complex PTSD. And my therapist is great, and it's like the more trauma work we do, the more I like get all these coping skills and coping mechanisms. A lot of things have gone away, but there are certain things that have gotten significantly worse. Panic attacks all the time. I developed pretty much full-blown agoraphobia. I was afraid to go to the store. I was afraid to drive. I was really afraid to do anything except walk around my own house, and even that was kind of scary at times. I lost my ability to work on the computer. I lost my ability to do pretty much anything that involved me having to see. Staircases, out of the question. And I just felt really like I am just so traumatized that I am like beyond repair. I used to think, this is a funny one. I remember telling my therapist this, and this is when my therapist said, I think there might be something else going on. I told her I was having panic
Our
attacks
therapist.
when I was like driving or when I was in the car, especially if it was a full moon, because I would think the moon was getting closer or too close or moving. And I'm like, I'm having such severe panic attacks that I'm hallucinating. And she's like, I think there's something wrong with your eyes. And I was like,
Wow.
really? And like, yeah.
Wow.
And that's around the time I saw your videos. And I remember telling some people in my life about your videos, and they're like, oh, yeah, maybe. And I'm like, no, this has got to be it. This has got to be it. And I immediately started following you. And I remember on one of my videos, you commented and you said, hey, not to be like, one of your eyes is misaligned. I was like, oh my God, you can see it. Because I've told people forever, one of my eyes
Yeah.
points in the wrong direction. And everyone's like, no, it doesn't. And I'm like, yes, it does. Which is why sometimes I feel like people are like, oh, you look kind of like Uma Thurman. It's because one of my eyes is crooked. Like,
Similar to Thurman's.
yeah, it's like, so the panic attacks, especially while driving, being completely unsure of where I am in space, grocery shopping out of the question. Yes, these are prism glasses. I can like read now. This has been life-changing. I went to the movies for the first time in over a year, 2 nights ago, and it was so much fun. This whole vision issue has really exacerbated other underlying conditions I have. Like, I have POTS syndrome, which is my autonomic nervous system and my vagus nerve are not working properly because I have a connective tissue disorder. But this visual disturbance has really made my POTS and autonomic dysfunction so much worse because I'm constantly in fight or flight mode because my eyes and my brain can tell I'm not safe. Like, I don't know. I have poor proprioception. I don't know where I am in space. So I haven't had a single panic attack since I've gotten these glasses. I haven't had a single headache. And I have debilitating headaches for the last 5 years. I've had a headache. Cannot get rid of the damn headache. No, I'm not tired. I'm always freaking exhausted, not tired. Like, it's
Energy.
crazy. And the moment I put the glasses on, the person who was making my prism glasses for me, because they are specifically made for each individual person.
Right.
She said
Absolutely.
she knew the moment she got it right because she said I like
Yes.
saw me relax.
Yes. Yes. I see that in the exam chair day in and day out. As soon as I lower, just drop it in front of one eye, they go like, oh my God, what was that? And just
Mhm.
get weirded out, right? Like, what did you do? It just felt like weight was lifted off my half of my face.
Mhm. It's been interesting. I wanted to ask you this specifically because I've noticed since getting these glasses, and I don't know if it's related or if it's just something else going on with me, but have you heard of or have you personally had experience with when you start wearing these glasses more often after an extended period of time of not having them, um, any sort of like emotional changes?
Oh,
Like,
absolutely.
I've been finding that I've been having kind of like these waves of almost like sadness come in
Hmm.
and then lifting. But like normally I'm extraordinarily anxious and having panic attacks, but I'm not having those. So I don't know if my brain's just trying to like put other things in
Yeah.
place.
Well, at any time your body and brain are going through changes, especially such drastic changes as visual changes, the rest of the brain, the rest of the body need to bring everything into harmony again, right? Because body wants balance, your brain wants balance, your body wants balance, everything wants balance. So there, there's that adjustment period, the adaptation period. But the types of changes that I keep noticing every time I get new prism glasses myself, the amount of energy I have, how much I yawn throughout the day, how awake I am at specific times of the day. I
Mhm.
can last longer. I'm not as sleepy at later times. I can wake up much easier
Me
because it's
too.
easier for me to open up my eyes.
Hmm.
And when you wake up, it takes less time for you to get your day started.
Right.
You know how some people have to wake up and they have to have their coffee, and if they don't have their coffee, they can't start their day. That's because when they're waking up, their eyes are just exhausted. They're already waking up exhausted.
Mhm.
And muscles take time to start working and kind of loosen up. So coffee just really kickstarts that process. Caffeine, the biggest effect of caffeine are on the muscles. So
Mhm.
we have muscles controlling a jive. And that's why suddenly everyone's like, wide, right? Eyes wide, lids wide
Right.
open, awake. And yeah, so it truly makes a difference. And then that, of course, has an effect on your emotional system. Like you're saying, I started feeling more confident over time. I'm more relaxed. I'm less anxious. I don't have to constantly dart my eyes around and change my focus to make my eyes feel comfortable.
Or
This
like
whole
closing one or like
yeah, this
squinting.
whole time we've been talking, if I didn't have my glasses and, we're trying to make eye contact and keep eye contact over Zoom, I'd have to constantly just look around because just my eyes getting
People always thought
tired.
I was rolling my eyes all the time. They're like, "What is your problem?" Because like I don't know if it's because my eyes are big, but like I'm constantly like doing this, and people are like, "Am I like annoying you?" And I'm like, "No, why?" And they're like,
Doing
"You have
like
like
a reset. You're
yeah,
kind of stretching your muscles, right?
yeah."
You know how we're sitting around, we do this?
Hmm.
That is the stretching of the eye muscles.
As soon
And
as I take
at
these
the
off,
same,
my neck is like screwed up.
exactly.
I can't see.
Let's put them back. Let's put them and talk and feel normal.
What kind of specialist do you go to if there's no one around to diagnose you? It's a hold on, it is a neurovisual optometrist,
Right.
correct?
There's different names. There's different names. So there's
Okay.
binocular vision specialists, there's neuro optometrist, neuro ophthalmologist, neurovisual optometrist, behavioral optometrist, developmental optometrist. But the thing is, many different optometrists do different kinds of treatments. So not every single optometrist feels comfortable prescribing prism glasses.
Hmm.
Majority of binocular vision specialists and neuro eye doctors actually do vision therapy, which is great. and it does work. It is effective. There's plenty of studies on it. There's plenty of research on it, but it does take time and it is pricey. So if anybody has the resources, has the money and the time to devote to it, and of course, as we're talking about the changes in a person's life, it has significant changes. So it's definitely worth it at the end. But the thing I love about the prism glasses is immediate, like you said, you're sitting in there and you're trying to get out and you immediately feel relief. So the second I'm sure you got your glasses, you put them on and you already started feeling the changes, like from the first second you started wearing them.
Yeah,
Correct?
I did. Like I found that I was always having this issue. I kept talking to my doctor about it. I'm like, I call it manual breathing, where I was always like holding my breath and like having to remind myself to breathe. And like I haven't had that issue. And I think it was just because I was so freaking anxious and tense all the time because I literally couldn't see because everything, like my vision looked weird. Everything just looked weird, but I couldn't describe it. And they're like, your vision is fine. And I'm like, that is impossible because like it looks weird. It looked blurry. It looked like overlapping and moving. Somebody asked, what is the difference between, I'm going to butcher the name, like
Strabismus. So
yeah.
strabismus, this is the same thing. So
Oh, okay.
I'm gonna make a video on that. Pretty much the things that you've been diagnosed with, that you already know, things that you have a history of, such as a lazy eye, strabismus, exotropia, esotropia. There's so many names for this, but they all fall under the category of binocular vision dysfunction. So strabismus is the literal definition of an eye misalignment.
Okay.
But again, there's like hundreds of different types of strabismus. There's constant that, you'll see one eye is constantly out in one direction or inward or up or down. So there's so many different possibilities and combinations of things it could be, and all of these different combinations, as long as they're not looking in the same direction, they're going to cause these symptoms. They're going to cause these compensations. They're going to cause these kind of asymmetry in the rest of your body and the rest of your system trying to compensate for this issue. So all of those things fall under the category of binocular vision dysfunction. So strabismus is also a type of binocular vision dysfunction, is BVD. Strabismus is BVD.
Interesting. That's good to know. Speaking of an asymmetry, I know earlier you mentioned you see it in celebrities. I gotta say, like I said, I saw a movie for the first time in a year, and I saw the Barbie movie, and I noticed that Ryan Gosling's eyes are off. But the thing I noticed most, his eyes always been a little off, but what I noticed most is one of his eyes as he's aged actually looks like it is sitting lower than the other. Is that an optical illusion, or is there
it is
muscular change?
This is it. No, this is it. Actually, so there are these 6 muscles that are holding our eyes in place, right? So if any of these muscles get affected, or the cranial nerves that are responsible for holding these muscles in place, any of them get affected, one of your eyes is gonna droop. And as it droops, it creates this droop in the whole half of your face. Now, there are conditions like Bell's palsy that can also cause a droop in the lid. There's so many different conditions and infections, 7th nerve palsy, and there's so many different things that can cause, like a stroke, for example, and can do the same exact thing. So it creates this vertical asymmetry both in your facial symmetry, so you get this facial asymmetry, and it's a vertical asymmetry of the actual eye position. So the pupils are pointing in different directions and the brain is perceiving differently leveled images. So when you have your head straight and you're trying to get the horizon, get a nice level of the horizon with your eyes, you won't be able to, because your one eye is thinking it's a bit higher, your other eye is thinking it's a bit lower, and then you have this mess with your vestibular system. So that is the case. It is not an optical illusion. His one eye is a bit higher or lower than the other one, and I'm sure it causes a lot of symptoms for him that he probably has no idea about. Which is why actually I do those celebrity eye reading videos. A lot of people think I'm calling them out or somehow disrespecting them, but what I'm trying to do is bring awareness to this epidemic, as I was saying in previously, that a lot of people have it, including celebrities, including famous people, and I'm sure at home behind the cameras they're suffering. They got the migraines, they got the anxiety, they got the panic attacks. And just like the rest of the public, they're seeing all these different specialists, getting all kinds of wrong medications, which drives them to the point of insanity.
Yeah.
as you were experiencing yourself going into that direction.
Yeah. I was really just like, I was so devastated. Like I was, I couldn't do anything I loved anymore. And I thought it was a personal failing. Like I am just I can't handle my emotions at such a severe level that it is literally like debilitating me. I wanted to also ask, what, because when I went to a place in Long Island. It was the Neurovisual Center in Long Island. Fantastic. Highly recommend them. I highly recommend you too. You were the first person I saw about this via Zoom, but you were able to at least point me in the right direction because you're on the other side of the country in Los Angeles. But I know that there are a number of things that can cause this. In me, the doctor told me that it's the connective tissue disorder. That's going to cause obviously loose connective tissue. That's going to already start me off bad. I had a concussion as a kid. Then I developed encephalitis. I have had Lyme disease and mono. And I noticed a big shift. They were already screwed up. Okay. They were already completely screwed up. My vision got so bad that I could no longer read without literally like doing this and like zooming way in on my phone and having huge text like my grandmother used to have. After I had COVID, I noticed COVID seemed to have made it maybe worse. And I don't know if that was coincidental.
Yes.
Somebody know, is this COVID related? And if it is, what do we do about it? Ow.
Just today. So, by the way, I gotta thank you for these videos and this awareness you're bringing. Since making those videos, I'm getting crazy amount of appointments, Zoom consultations scheduled online from people all over the world. Simply because of that, of those videos. And just today, I did three consultations with post-COVID symptoms.
Mm-hmm.
That the virus itself, I don't know if you remember, Dr. Fauci kept talking about neurological changes. It can cause neurological damage.
Yeah.
This is in the category of neurological damage. Any of the eye muscles could have been infected, could have been damaged, could have been inflamed, and could have changed the posture. Any of the cranial nerves could have been damaged, could have been affected, and could have changed the posture, or part of the brain. So absolutely, there has been a huge rise of these symptoms post-COVID. And everyone's talking about the post-COVID mental health changes and the structural changes and the muscular changes. But this is a big change too, because this is how you're perceiving the world. So a little drop in the eye, a little change in the direction where now your eyes are struggling to point in that same general direction, you have these symptoms. You have the migraines, anxiety, panic attacks. And again, no medication helps. Muscle relaxants get rid of the strain of the muscle, but you're not functioning as a person. Anxiety medications dull down the signals that your brain's feeling. So you're still feeling the pain, you're still feeling the pull, you're still feeling all the visual, perceptual weirdness, yet you're not feeling, again, the pain of it. So all of these things are just knocking out your sensation of it, but the physical causes of it, the actual damage that is happening, the inflammation, it's still going.
Right.
That's why people just spiral down and there is no improvement with any of these medications.
Right. Yeah. I noticed nothing was really helping me. Someone asked, can you have other symptoms like anxiety and blurry vision without the headaches? I can say personally that the headaches did not start for me until this kind of last year, is when the headaches and neck aches and, kind of like a lot of everything from like here back down my neck into my shoulders, that I only started having pain in the last year. And somebody also asked, why does it cause panic attacks? That's a really good question.
That is a really good question. So as we were talking about the eye seeing unequal leveled images, the second you open your eyes, your brain has to compensate for this issue. So your nervous system, your sympathetic nervous system is already activated. And it's activated because it has to try to activate these muscles to level up the other eye and make them team up, make them point in the same direction, make them work equally, make them perceive equally. So your nervous system is on overdrive. And then you add the tasks you have to do. Let's say you have an assignment, you have work, you have a boss, you have a schedule, you have a family, you have children, you have to drive. Nowadays, all of our tasks are visual tasks, right? It's not like thousands and millions of years ago. It's all of it is visually intensive tasks. So we keep adding the demand, and now these problems come out, and it just, your nervous system comes to a point where enough is enough. You get into that panic system. It's your brain's way of shutting down, like the computer heating up and shutting down to kind of prevent itself from getting damaged. Very similar concept. Your body goes into panic and it just can't handle it anymore. You need to reset, you need to shut down. And what's the first thing people do when that happens? Close your eyes.
Mm-hmm.
Right?
Mm-hmm.
Close your eyes. When anything feels too much, you close your eyes, because that just gets rid of a huge amount of overload that we're getting every millisecond of our lives.
I know, like, and I think, it's also like depending on, like, just basic tasks, like you said, like getting up, walking around your house. But then once, like, your brain knows, we know that, like, driving a vehicle is dangerous. Obviously, we're in
Very
like, a 3-ton death machine barreling down the highway at like 90 miles per hour. That's already a little bit, but like, it's like your brain is like, yo, you're not safe. Because I know I used to be so good at driving. I never got in an accident. My partner does not even let me drive, because like there have been a couple of times I've driven for like 10 minutes. He's like, pull over. You are literally going to hit somebody. And every time I park, I think I'm perfectly sure. I'm not even joking. I'm not like I'm almost completely like sideways. And it's now, I parked straight the other day. But it's funny.
Wow, look at that.
My mom parked sideways, and she's like, I don't know what it is. I've been so anxious lately. And she recently had a stroke. And now one of her eyes is kind of in a weird spot. And I'm like, Mom, I'm telling you. And like, the cool thing about the prism glasses is I put them on other people, because like it kind of like misaligns their vision for a second. And like, they're like, oh my God, how are you functioning? And these are like 50% of the like full prism that I'm going to need, because 100, she said, was like going to be a little bit too much at first. So I'm upgrading them in like a few months. But yeah, it's really
now the fact that you said that with your mother and the stroke, so that is a very important thing to have. So I don't want people to suddenly have these symptoms and then go find a binocular vision specialist, get the prisms, and then have relief, and that's it. Anytime these symptoms happen suddenly, let's say you've never had them before, like in your case, you've never had them before, and they come out of the blue, you're suddenly seeing double. You're suddenly having poor depth perception. Things are going in and out of focus. You're getting nauseous, anxiety, panic attacks. They're new. I still suggest people go to, whether it's the emergency department, primary care doctor, a neurologist, a neuro-ophthalmologist, to figure out why out of the blue, why it happened suddenly. Because as it happened with your mother, these symptoms could happen with stroke, with a tumor, any kind of life-threatening or sight-threatening conditions. So if it happens suddenly, a very thorough evaluation must be done as soon as possible. But the type of patients that I see that binocular vision specialists should see are the ones that have already gone through all that testing. And if we're the first ones to be sent, exactly. If my patient says you're the first doctor I'm seeing, I'm like, all right, you're going to see way more doctors.
Right.
Because I'm going to send you to them. But a lot of the times, most patients that come to me and make these consultations with you are the ones that have seen every single doctor in the book. And they've already done every single testing in the book, and they've done every single treatment and every single medication. And it just making them get worse and worse and worse, and they're not finding relief. So this is when it's worth it to look in this direction, especially when a lot of the symptoms are lining up. So if your vision is going out of focus, you can't stay focused because of it. You can't stay balanced. You're missing a step. You're hitting a furniture. All these, you're cutting a finger, something like that. It's got to be the eyes. It's the alignment, and it changes the perception, changes the way you perceive space, creates this nervous system overaction, and boom.
And then other things started to. I was becoming extremely sensitive to sound.
Yes.
I would have to wear earplugs all the time, like to the grocery store and stuff, because I found it helped me. And, I was like, oh, maybe that's just some of my like neurodivergence coming in here, which it certainly is. But I noticed that these symptoms got exponentially worse, kind of like without me. It was just strange. Like, I've had certain symptoms my whole life because I'm like, neurodivergent. But some of these were just like, why all of a sudden is this like so severe? Because I have worked on so many things to like, calm my system down, and the sound and stuff. The doctor that I saw told me that's really common, that your brain's overloaded. So like if you like kind of like take away some of the sound element, it's like your brain's just doing too much because you can't see correctly.
All right. So a couple of things you said that I want to kind of talk about. One, you talked about the sound, the neurodivergence, and then you mentioned one more thing. I kind of forgot already, but okay. So let's talk about the sound. So why is the sound an issue? Just like your doctor somewhat explained, that's absolutely true. So we're getting this sensory information from many different sources, right? We're getting the sounds from our ears, we're getting the balance from our inner ear vestibular system, getting proprioceptive feedback from our muscles in our body, and we're getting visual feedback from our eyes.
Mhm.
So when one of those systems go out, they're not normal anymore, the rest of the systems fall off. And now they're trying to compensate. They're trying to bring the body into this equilibrium again, into this balance again. And now they're not communicating with each other properly. So when this visual stimulation becomes too much for you, now it's any kind of sensory information is too much for you.
Right.
Any kind of sensory information. So then now you can't pay attention to your balance if you can't even see it, right?
Right.
Or you can't even see. Now how can you pay attention to what you hear? So everything affects one another. So this becomes the sensory overload, this sensory overaction. So what do? We knock out one sense. Close our eyes. Now you can hear better, right? We lower the volume when we're trying to look for a street address, or when someone's trying to talk to you, you're like, hey, can you lower the TV a little bit? Because this is all too much and it's too difficult for the brain to process it. And if you're already having issues processing your vision, you're going to have issues processing sound. So that's one of the main ways it affects. Now, why is this common in neurodivergence? Anytime I mention, hey, if you have ADHD, you must have BVD, or you likely have BVD, or if you have autism, you likely have binocular vision issues, as well as sound sensitivities. And then they're like, oh no, it's just part of being neurodivergent. Neurodivergent is not a condition. It's a set of things that happen all at the same time, creating the neurodivergence. So I believe part of the system that is off from normal is the visual system, creating the neurodivergence. So as you experience yourself with your new recent prism glasses, a lot of your neurodivergent symptoms have improved already.
They have
and
definitely improved.
Improve even more over time. So the more accurate these prisms are, the more lined up your vision is, and the easier time your brain is taking that all in and processing it, the more time and energy it's going to focus on all these other things. So it's not going to be neurodivergent anymore. It's going to be focused on whatever task you have to accomplish.
Interesting. That makes a lot of sense, because it's like, it's kind of, neurodivergence is definitely kind of like an umbrella term.
It's like anxiety.
So many different things that are going on. And I've definitely noticed like so many of my symptoms are better with the prism glasses. So I obviously just got prism glasses, but is this something where it gets worse if you like don't get prism glasses, or you don't do vision therapy, like over time will it get worse?
I believe so, because I do see patients from different age groups. So I've diagnosed BVD in patients from 10 years old or 5 years old all the way up to 80-year-old. And in 70 and 80-year-olds, what I see is, with a lot of these postural changes. So, of course, associated with arthritis and everything else. But I feel like it also has to do with the fact that these strains and these pressures on our body just constantly compounds over time. And it just kept getting worse and worse and worse and worse, because your body's compensating every second of your life for years.
Right.
Oh, I believe so. I believe it does get worse. And when you get the correct prescription and your vision, you're suddenly perceiving things correctly, and everything else is happening much more comfortably, your nervous system, your muscular system, everything relaxes, and it just gets better over time. So now you have less and less tension over time. So I think not treating it does have a compounding effect over the years. Absolutely. Plus, not to mention all the symptoms you're experiencing and all the different medications you're taking for it, having the cumulative negative effects on your body and the visual system, since majority of them themselves cause BVD.
Interesting. That makes sense. Someone is asking about cervical dystonia. Is that something?
I mean, everything is connected in our body. So cervical dystonia, the cervical system, it's not able to keep your posture straight. So your neck is not going to be straight. Your head is not going to be straight. So because of cervical issues, your head is going to be tilted. And because of this, now your vision is off again because you're still not seeing straight, but you can't straighten your head, right? So now, again, your eye muscles, your visual system has to compensate for this too. So yeah, one thing can lead to another. Eye issues, eyes being misaligned because of the muscles and the posture and the stroke and whatever happened can create this head tilt over time and create the cervical issues over time. But if it starts off as a cervical issue, then it can create BVD over time because our whole system, again, one has to compensate for the other. They all need to work together as a team. And when one thing's off, the rest of the system goes off.
Interesting. What about, I've seen a few people say a few different things. I've seen some people mention surgery for this condition. I've seen some people mention Botox.
Yeah. So Botox works with migraines because
I get it in my forehead.
Our muscles get exhausted, right, from trying to elevate our eyes with certain types of binocular vision dysfunction. So people start having pain in their eyelids, on their eyebrows, and on their forehead.
Yeah.
Botox is just like a muscle relaxant, right, or a nerve relaxant. It takes rid of that sensation, that strain, that pull, relaxes it, right? It paralyzes it pretty much.
Yeah.
And now you feel relaxed. But functionally, now can you compensate for an issue, for a misalignment? Much more difficult. So pain-wise, they help. But I think visually, as far as the perception, you functioning confidently, with quick reaction and processing and everything, just doing things quickly and comfortably, I think that's going to be tough with it. And same thing with surgery. Surgeries can change the posture, and surgery is an option for significant amount of binocular vision dysfunctions, like the ones that are very obviously out, and prisms don't help. Vision therapy doesn't help because the prisms would be this big, and the vision therapy would take forever or not help at all. That's when surgery is considered. But even after surgery, vision therapy and prism glasses are still recommended because a lot of the surgeries that they just do a surgery and nothing else happens afterwards, a lot of those types of binocular vision dysfunctions change direction. So if it had started off as an outward alignment, it becomes an inward alignment. Now it creates a whole set of its symptoms, and vice versa. When an inward alignment is corrected with the muscles, they shorten it and stretch it out. When it's corrected, sometimes it can turn into an outward misalignment. And now you get the whole set of problems with that. So surgery is recommended in those extreme cases, but again, it's not 100%. And vision therapy and prism glass is still recommended after it.
Interesting. That makes sense. Someone had asked, cervical dystonia. Yes, we were just talking about kind of cervical, dystonia and stuff like that, kind of like how your eyes misaligning will kind of like, you'll compensate by like changing your posture, which can cause or, make certain issues worse. But it's kind of like what came first, chicken or the egg, hard to say.
Right.
I feel like I didn't remember to ask the doctor this question. So my eyes have obviously gotten so much worse over time. Which is also funny, when she was doing my eye exam, like the basics just start off, nothing funny, no funny business. She's like, what's better, one or two? And like, when I tell you, I've just like always kind of thought like they were like giving me like either like a psychological compliance test, or like if they were like kind of messing with me. I would always just be like, two, but like they literally both look like shit. And she's like, which one's better, one or two? I'm like, she's like, you can say they look the same. I'm like, oh, I can, because no one's given me that option. They all look like shit. She's like, okay. And then she like put something in it. She's like, how about now, one or two? I'm like, oh, now it's clear. So like, even with one eye closed, it was still like totally screwed up. Does this, like, if I wear the prism glasses and I don't do vision therapy and just wear the glasses, will my binocular vision improve without the glasses later?
That's
Nice.
one of the things that I've seen
Hell
with
yeah.
a lot of my patients. When it is correctly prescribed, and that is the hardest part about this, when it is correctly prescribed and there's still not a residual amount of misalignment, then as your muscles relax, as your nervous system relaxes, your cranial nerve relaxes, when you take the glasses off, now your muscles and nerves are more relaxed. So they're more flexible. They're not very rigid. They're not very strained. They're not in this spasmic state, which is what you were experiencing during your eye exam. The reason why one or two both felt like shit was because your focusing system in each of your eyes was so strained from compensating for this issue that as she was presenting a lens, it was taking time for that focus to adjust to it. So this issue creates a mess in the whole system, including the focusing system of each individual eye. So now that it's corrected, now that focusing system is also more relaxed, when you go back for your even routine part of the eye exam, you're gonna notice a difference between those changes much more easily because that lens system, the focusing system in your eye is gonna adapt to those changes much more quickly.
Interesting. I know with the one video I posted, and by the way, I wanted to say earlier too, which I kind of forgot. I'm glad so many people have reached out to you about this condition since the videos, but I just want to reiterate, this is not a sponsored post, right? I'm not getting paid to do this. This is literally just like, I saw your video.
I'm only getting paid for the services.
Right,
I
right,
stopped paying.
right. Like, I just want to reiterate that this is just like, I was like so enthusiastic about how much this has improved my life that I was like, I need to let people know about this. But when I made the video and I'm like, put your thumb in front of your face and like close one eye and then the other. Now that I have these glasses, this is only 50%. Before, like if I do that right now, it's here. And then when I close, it's literally doing this back and forth. And like, but I guess a little bit of movement. When I put on the prism glasses, they're only 50%. It's doing more like this. How much is normal? Because I didn't specify that in the video, and some people are like, it's moving a tiny bit, and I'm like, well, I don't know. What's normal?
Yeah. No, there is no way to visually, I guess, measure that perception.
Okay.
Because some people are like, oh, it's about an inch, but I'm like, an inch from what distance, right?
Right.
Because if it's an inch from here, that's a bigger distance than an inch here. So that makes a difference. So there's no way to tell, but there are distances with prism glasses that my eyes are perfectly lined up, and I can tell because I'm actually experiencing full 3D vision. When I drive, it feels like I can see all around the car, not just one part of the car, one side of the car, but all around the car. It's a kind of crazy thing to explain.
It is weird. Yeah, it's like there's either too many dimensions or not enough. I don't know what it is, but it's not quite.
So it creates dimensions. So because it's not fully correcting it, you still have that little bit of a difference that your eye's still compensating. But what I realized, and I've done that test while I'm driving, I wouldn't recommend it because it changes your perception. But when I've done that test while I'm driving and I'm experiencing perfect 3D, that car feels like it stays the same as much as I switch between eyes.
Right.
So I'm like, oh my God, even myself, that at any point when it feels like aligned, it's not perfectly aligned. There's still a little bit that your brain is compensating and your eyes are compensating. And a lot of doctors think a little bit is like this is okay because this is what's making your brain converge your eyes and put these two together.
Right. So a little bit is okay.
Yeah. So a little bit is okay as long as you're not having a lot of those symptoms we talk about, as long as you're not watching my videos and you're like, yeah, this is me, this is me, this is me, this is me. A little bit of difference is okay. But it should not be diagonal whatsoever.
Oh, I went grocery shopping yesterday too, and I didn't have a panic attack. Which is so wild because literally when I go into the grocery store, I like automatically get so pissed off and I just want to get like the fuck out of there. And I end up spending so much money because like, of course they put things that are most expensive at like eye level. And like, I can't read the shit, especially with the fluorescent lights. It's like too much. So I'm just like grabbing what I need and like literally getting out of there. Like but I was like able to like actually like, oh, look at what I'm buying and not have a freak out panic attack. That one of the videos I made, some like visual doctor duetted me or something or like stitch it. And he's like, this is a really good video. However, he's like, this isn't the type of doctor you need to see. And however, like he would like pretty much like debunk my whole video. And I'm like, oh, well, I mean, that's like sucks, but I don't know. Like, I just was like, really? Because he was like, oh, a visual or a neuro.
I think he said, I think I know what you. Oh, I think I saw that video too.
You know what I mean? He was like, well, a neuro visual.
Yeah, because you said ophthalmologist. That's why. You didn't say
Oh,
optometrist, you said an ophthalmologist.
what's the
And
difference? I know this is such a stupid question.
no, it's not a stupid question. Actually, that's a very common question that I'm asked all the time. A lot of people don't really know the difference between ophthalmologist, optometrist, and optician, right? So opticians make the glasses,
Okay.
send the orders to the labs. They know how to do the frames and the lenses inside the frames and all the right adjustments. And they should be able to put prisms in these frames. So that's lab, that's optician. Optometrists are eye doctors that have gone to optometry in the United States. This is different in England and everywhere else, but in the United States, you go to 4-year optometry school, you get a doctor of optometry from board optometry in California. You get an OD and you become a doctor, an optometrist. Now, the difference is, and this is changing from state to state and it's constantly evolving, is the main surgical procedures. Ophthalmologists can perform surgical procedures, optometrists can't. But again, that's changing. Now optometrists can perform minor procedures, at the slit lamp or something topical. Like for example, when somebody comes to me with a metal in their eye, I'm allowed to take it out and treat damaged cornea. And 100 years ago, 50 years ago, that wasn't the case. So a lot is continuously changing. Now, ophthalmologists, they're the ones that do the surgeries. So you'll get the neurosurgeon, the strabismus surgeon, the cataract surgeon, the retinal surgeon. Their main source of income is surgery. So they don't really go into the vision therapy. They're not going to really prescribe glasses or really focus on that because their bread and butter is in the surgery. So that's, I think, where the whole thing came from.
Okay, that makes more sense because I was like very just kind of like confused by the video, but now that makes a little bit more sense to me, I guess. There was another question that popped into my head a second ago. I've also found that I'm like not losing my thoughts as quickly, which is really
nice. Changes in speech.
Yeah, like I'm not like tripping over my words as much. I just feel like literally by this time of day, I'm usually like so freaking anxious and like tired that like I literally can't even walk around my own house. Like I will run into everything and I just like am nauseous and it's just awful. Like it was terrible. So this is like such an improvement. I like wish I could like explain it to people, like how much of an
right? So that's what I'm having a hard time with, constantly making these videos consistently and trying to not explain it in medical terms. It's strabismus and exotropia and everyone, who cares about that, right? But it's the real life effects that causes. It's the changes in your posture, the changes in your behavior, in your ability to go out, to interact with people, to have friends, to feel confident in front of your friends, make contact with friends or a new person you're meeting. How can you make eye contact with a new person you're meeting and be confident and stand in front and shake their hand if your eyes can't physically look up and meet their eyes?
And it makes everything look weird. I wish there was a good way to simulate the way things look because there really isn't a good way. But like everything just looks weird. That's the best way I can describe it. Even the doctor that I saw said like, yeah, that's kind of the best way to describe it is weird. But like looking at people, especially if my eyes were tired, it almost like really kind of freaked me out. It was like almost like uncanny valley sort of deal, like where like people's faces, like because my vision's kind of like moving all the time. So, like almost looked like their face was like moving in unnatural ways or didn't quite look right. And it made me very uneasy to look at people because I would get like startled by like how their face would change in kind of an unnatural way because my brain's trying to like put the pieces together and it just made it look like scary. Like they almost look scary. So I didn't like to look at people.
Yeah, and that's the tough thing to try to explain to people that, this mental health condition, derealization, depersonalization could actually be this. And, you see a primary care doctor, you say, hey, I'm experiencing this visual, weird, dreamy sensations. They go, oh, dreamy, derealization, mental health. Psychiatrist, oh, derealization, medication. Number one side effect on that medication, blurry vision, double vision. What happens? Worse. And then it just gets worse and worse and worse and worse.
That's a side effect of Adderall too, which, or stimulant medications. A lot of us with ADHD have this condition and Adderall causes blurry vision and like dizziness.
Or it can actually cause the opposite. And then a lot of people with ADHD, it actually improves their vision and makes them more stable because dopamine is responsible for our muscles to move as well. So
Huh.
constant hit of dopamine. That's why when people are hyper fixated, right, on a video game, for example, they're getting that constant hit of dopamine. It's keeping their eyes focused and like locked in. So the opposite can happen, which is the same thing with coffee. When you're waking up, you're drinking coffee, it goes into your muscles, you got them working. So yeah, it can affect different visual parts in different ways. So in some cases, Adderall can cause visual side effects and issues like blurry vision, double vision, and things like that. And in other cases, it can actually improve your vision and keep it more focused.
That makes sense. Somebody asked if there is a connection between this condition and like post-menopausal women.
Oh, yes. So that's the one thing that I actually wanted to, I think that's the third thing that I forgot about. Remember, I was like, there's one other thing to mention. So I gotta tell you, I am, of course, looking at the people that follow me, the demographics, the gender, and things like that. And 80% of my followers on every single platform are women. 80% are women. That's a huge number. And I'm thinking about, I'm like, why is this the case? On YouTube, on Facebook, on TikTok.
If it's across all platforms, that's unusual.
And I think the reason why that is because of the connection to hormones and hormonal changes.
Interesting.
I think that is why. And I continuously see patients that have had binocular vision dysfunction after a drastic event in their life that created a hormonal change, such as pregnancy. A lot of eye postures change after pregnancy. A lot of visual functions change after pregnancy. I actually did a binocular vision exam on my wife pre-pregnancy. And then, just like regular exam, she was having the symptoms. And then she was pregnant, we had a child, and then she started having these weird symptoms that also match with BVD. I was like, hey, we gotta come back. Let me check your eye posture again. And I did. And her eye posture was completely different from previously. And I was like, mind blown. I'm like, how is this possible? You went from this direction to this direction, and now you have a whole set of different symptoms, which is matching with that posture change. So, and I see that day in and day out. So hormonal changes, during the premenstrual cycle, there are visual changes that link up with that. During menopause, post-menopause, pre-pregnancy, pregnancy, after having a child, autoimmune conditions that cause significant changes in hormonal levels.
I was just going to say that because I was just thinking when you said that, I was like, hormone levels are different. I developed, because I was on prednisone for like 6 years, I had like a Cushing's syndrome for a short period of time. So I had to immediately stop taking it. But things got so weird with my vision during that time. And like, they just didn't
when
go
you
back
stopped or when you were taking them?
It started happening when I was taking it. After I stopped, it was just like completely like fucked up, just like so bad.
Because it couldn't go back to normal. You took it for 7 years. Prednisone has a significant amount of side effects on the visual system.
Oh, really?
And I'm not talking about the cataract and the glaucoma.
Wait, can it cause that? Because they told me that the what is that thing in your eye? The nerve, the optic nerve. They said I have higher eye pressure and that my optic nerve is enlarged, and they freaked me out because now I'm like, do I have glaucoma? And they're like, well, you don't have any scar tissue, so probably not, but we'll keep an eye on it. But like, do I have to worry about that?
I don't think so, as long as they're keeping an eye on it. So one thing that doctors are really good at is diagnosing and monitoring glaucoma.
They did an extra test and they said no, but could that be from the prednisone use? Because it didn't used to be like that.
7 years, absolutely. Absolutely.
Oh,
absolutely. So actually, some people should be even more careful in taking prednisone, and these people are labeled as steroid responders. So in them, taking steroid significantly increases their eye pressure and increases the risk of glaucoma. That is why prednisone, part of the side effects, one of the main side effects is glaucoma and cataracts. So asthma and chronic kind of conditions that need chronic prednisone medication over 7, 8, 10, 20 years will have a significant impact on the visual system.
I did not know that. See, and like everything, you can like, there are doctors that like, you can tell they care about their jobs. They like their jobs. And I find like the best physicians are the ones that are always learning and like looking.
I love learning.
And you can tell
one of my goals.
Everything and anything about like this topic, which I love. I love it.
I love learning, and I'm continuously learning from my patients too and their experiences. One of the craziest things I saw 2 days ago. So a lot of people ask me, "Hey, is tinnitus related to this?" And I'm like, okay, tinnitus, buzzing sound. There's kind of treatments that when you start doing that spoon thing, when you keep tapping it, kind of dulls down the nervous system and dulls down the sensation and the sound. So I'm like, maybe there is a connection to tinnitus and the binocular vision, that physical pull and strain that your muscles are experiencing. So a couple of days ago, one of my patients that saw my TikTok video made the appointment, came all the way from Texas to California for the exam. As I put the prism in, and then initially she was like, yeah, I have tinnitus, I have this, I have that. And she's telling me all the different things she's experiencing in the moment. She's like, oh my God, I feel more relaxed. My head is straight. Wow, I could see both sides of my vision. And then she turns around to her husband. She goes, wait a minute, my tinnitus. Usually I have to focus on not hearing it. And now I feel like I have to focus on hearing it so I can hear it.
Interesting, because my mom also has tinnitus all of a sudden with this eye shift, and she keeps going, like, she's like, is it from the stroke? She thought maybe they knocked something loose with surgery with like the bones in her ear, and it's no, she doesn't have vertigo though. So they're like, if it was due to the surgery, she would have also been experiencing vertigo, but it's just like, she said it's just like constant and super annoying. She needs to go see, I told her, you need to see my mom. You need to see my mom, and you need to talk to Carol, because she's so stubborn, and she's like, maybe I'll deal with it later. I'm like, no, Mom, I'm telling you, a lot of this stuff that you're experiencing that you're just like, oh, this is neurological, because I've had severe neurological problems like encephalitis. And I'm like, I know what you're experiencing. And like, I'm telling you, like, at least 25% of what you're experiencing has to do with your freaking eyeballs, which could be a neural problem too. But do you know what I'm saying? I'm like, you could probably help, like, deal with a lot of this stuff if you just get like glasses.
What bothers me and what worries me is that more people are not talking about what we're talking about. That's what bothers me, because how are you receiving this information from the outside world if not from your eyes? Are you walking around with your eyes closed? No, we're walking around with our eyes open and perceiving everything. So that's the first step, getting information from the outside world. So isn't it obvious, if you're not getting that information correctly, everything else that follows is going to be off?
You would think. And it's like, I kept saying I can't see. Like, I would literally be like, I can't see. I can't see. I didn't know if I had like blind spots, but they kept saying my vision was normal. And the best way I can kind of describe it was like, if you're like looking at a 3D movie without 3D glasses on,
Exactly what it is.
how everything's just like, what's
exactly
like, it's just like weird. It just looks freaking weird. And could it cause eyelid twitching?
Yeah, because that's the muscle and the strain that is getting pulled. That's another interesting thing I've seen with the prisms. So I think that was a couple of weeks ago. So the bottom lid, sometimes you can see the people's lids twitch, and every time I would take them off, the lid would twitch a little bit. Every time we put them off, we would look for it, it would go away. We're like, okay, well, this also makes sense, because your lids, right? Everything, this whole system, this whole area is trying to do everything it can to have you see as clearly as possible and as comfortably as possible. Those two main things. So it does everything it possibly can for that to work. So like you were saying, the blind spot, so it blocks part of your vision so you don't see double. It tilts your head and turns your head to the side to make it feel comfortable. The lid's twitching because now you're using these lid muscles to try to get your eyes to focus, and it's getting pulled and strained. Absolutely. Yeah, it could be part of it.
I noticed like a lot of times people, more so in person, because like, it's harder to tell on online, but like in person, people, oh, are you okay? You look tired. You look tired. Everyone always says I look like sick or tired because I have such bad dark circles under my eyes. They're very, very dark under my eyes. And I've noticed that I have not been getting people telling me that as much. And I've even noticed when I look in the mirror, I'm like, oh, I don't have makeup under my eyes right now. Normally,
when you said dark, I'm looking for him and I can't see him.
It seems to have brightened it. So I don't know if that's like a circulation thing. Like it was just like, I don't know maybe it's just because they were strained and tired. They were getting like puffy.
Yeah, I think it's also has to do with that physical pull that it's doing, right? Your lids and your lower muscles are constantly working, so it's constantly stretching the skin right under it, and then it creates that hollowness right there. So now that's not happening anymore. You put your glasses on, all these muscles are not straining, are not pulling, are not swelling, are not getting inflamed. So now you feel better, right? When people are studying, They come out of the library, puffy,
Yeah,
dark,
they have dark
red,
circles. Yeah.
bloodshot, right?
Yep.
The nurses after work, that one guy on TikTok,
Yeah.
nurse,
Yeah, I know who you're talking about.
with the dark circles, right?
Yep.
After work, after a crazy shift, after driving home, after a long drive, they're puffy and red and dark because of this issue. And how come every single person that works at that location doesn't have the same exact experience,
Right.
right? There are some people you look at and be like, how are you normal? You work like 12 hours.
Right.
And then in the, meanwhile, I've been awake for 10 minutes and I'm already sleepy. So
Right. And like,
that makes sense.
I used to like have to spend over an hour before I could even get out of bed just because I'm like so like weird feeling. But like now I
Yeah, your
literally like
eyes.
no problem. I can get right up. Somebody was like, I'm gonna be so mad if all I needed was to get prism glasses. I'm 23 and have never driven. It's
Yeah,
possible. I mean, it's definitely I know how much it has impacted my life because it didn't used to be like this.
yeah.
So there was a significant shift. And I used to love to read. And like I just stopped reading altogether. And it's no wonder because if I take my glasses off and I try to read something or look at something, I'm like, oh my God, this is horrible. This is horrific. It's like they're like moving and
They're like getting off the page, which is what that initial thing you were explaining. I felt like
yes.
it's getting off. You on one line and then you're suddenly on that lower line. And then
It's
you're
like,
wait a minute, that's not a continuation of that other sentence.
it's impossible. It's impossible.
It's
And
really
now
possible.
like, obviously, and I can still tell it's funny because at first when I put them on, I'm like, my vision is perfect. It's 100% crystal clear. But now that I've been wearing these for a little bit, I can be like,
Oh my
they
God.
are a little bit misaligned still. It's so much better. But now my eyes have kind of adjusted to this and I can start to see like, okay, there is a little bit weirdness here and there. So
It's only going to get better. You're on the
100%.
right path. As
Yeah.
long as you're on the right path, it's just going to get better. And slowly but surely, I'm positive that all the medications that you were prescribing for these symptoms, specifically for these symptoms, you will slowly get them up. I've had patients that used to have monthly Botox injections, and they would take oral medications multiple times a week just so they don't get their migraines or they can take care of their kids while having a migraine even. And then, I would see it during a routine exam, have them come back for an exam, come back for the prisms, have them come back only a month after. And I've had patients literally break down and cry saying, I stopped my Botox injections because I feel like I don't need them.
Right.
Or I stopped taking my migraine medications because I feel like I don't need them. I stopped taking my anxiety medication. I've lowered the dose. And I'm hearing all these things from people. I'm like, oh my God, I wish I could record and capture every single patient experience. Like it just blows my mind every single time.
Yeah, I haven't needed to take like headache medicine. Normally it's like I don't even know how my liver exists at all with the amount of ibuprofen I constantly take. And I haven't been taking it, which has been really nice.
Yeah.
I don't need, I'm falling asleep easier. I think I just am in general more relaxed, so I'm not as like anxious. What treatment is this? Does it help with IIH? I don't know. Do you know what IIH is?
IIH is increased intracranial hypertension. So that's when the fluid inside the brain gets a
I
little
have
too
that
much.
sometimes.
Sometimes.
I think sometimes, yeah. Sometimes then I'll get I was getting like cerebrospinal fluid leaks. Is that the same? Like, and then it like that relieves the pressures. I don't know. I don't know.
Yeah.
I don't think I
You
have
have
it at
that
the
too.
moment. I've had it in the past with like
Yeah.
encephalitis. I don't think it's
Yes, that's that. IIH is that. It's
okay.
increased intracranial hypertension with increased cerebrospinal fluid, and it puts a pressure on so many parts of your brain. Your brain, overall brain. It depends where it's accumulating. It could put pressure on your optic nerves, can damage and swell them up. Optic nerves are the nerves that's responsible for sending signals to your brain. So if your optic nerves getting damaged over time and it's sending weaker and weaker signals, I think your eyes are gonna be less likely to want to cooperate together and work together. So yeah, I believe that would make it even worse and make it even more likely for them to be misaligned and uncoordinated and work independently instead of working together as a team. Yeah, anything that damages the eye, any part of the eye, any part of the muscles, any part of the nerve in the back, any part of that visual pathway that's sending information to your brain getting hit in the back of the head, right? That's one of the main things. anything along that pathway can create a binocular vision dysfunction, which is why I strongly believe it's an epidemic and why more doctors should pay attention to it and look for these problems. Because if you don't look for it, you're not going to find it.
Right. And someone actually just asked, what do you think it will take for more docs to, what's so cool? My phone is like so far away from me right now and I'm not squinting or like moving. Do you see me just like reading it?
Yeah,
Like,
yeah.
okay.
And you know what else I realized?
What?
So in a lot of the videos, this is an obsession of mine and obviously related to BVD.
Yeah.
When I watch videos, I only pay attention to people's eyes.
Yeah.
So I noticed their misalignments, right off the bat. I noticed the difficulties they're having. Before in your videos, you would constantly want you roll your eyes around. You had
like
in
this.
many of your videos. Yeah.
Yep.
And two, it was a bit slower and more off. Now you're like boom, 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 boom. Like your switching focus is so quick and it's so like spot on.
It is.
And
it's so
I
nice.
can tell it. Yeah.
And even when I take off the glasses, I'm a lot faster, which is nice.
Right.
Like there was a little lag right there. I can feel it. That little lag. I don't know which eye is screwed up. I think you said it was the right one.
No, it depends. Well, if a specific muscle is damaged, then it would affect that eye more. But it all depends on what direction you're looking at. Because in this angle, this eye is more comfortable.
Oh, right.
Facing in this angle, this eye is more comfortable. So it all depends on what direction you're facing and which eye is in front. Which eye is the most strained. There's so many factors that go into it. That's why it's so complicated and so difficult to diagnose and treat.
Gotcha. What do you think we'll have? Because I think this is a great last question to end on since we're running out of time. What do you think it will take for more docs to learn about BVD? Studies on prism efficacy?
No, because there's plenty of that. I don't think so. I think it needs to be more, like the importance of it should be more, I guess, emphasized in optometry schools.
Okay.
I think more patients should go into experiencing the symptoms, saying that I'm pretty sure it's from our eyes. And if doctors continuously see patients coming in, complaining of the symptoms and being sure that it's their eyes, not being able to help, it's going to make them feel inadequate.
Right.
And we'll hopefully get them to start learning more about it, start practicing it, start incorporating it in their practice. I mean, the number one motivation for doctors is money. So if there could be, that meme when it's like, I gotta make money in this.
Yeah,
so
yeah.
If they can figure out a way to make good amount of money, I'm sure they'll get into it.
Okay, that makes sense.
Yeah, but I don't think that should be the reason why doctors should get into it, because
Right.
they're still not going to be able to help a lot of people. I think the doctors that should get into it should be the doctors that want to make a difference, that want to change, want to make changes in people's lives and the public and the system, because I feel like medications are always there, surgeries are always there, and their side effects are always there. So if you can avoid those side effects by doing more natural, less invasive type of treatments, I think that should be considered first. So, if more people know about it, more of the public understand the connection of it, more doctors will pay attention to it and will hopefully learn about it. And I guess we'll hopefully incorporate it in their practice more.
I hope that more people start learning about it. And I think this video will obviously help. And I hope to do this again soon when I get my like other
talk about for hours.
Right. When I get my new ones, I'd love to like touch back when I get my like full strength ones. But this has been awesome, and we could definitely talk about this for hours. But it's gonna boot us off again. So thank you for doing this.
Great question. No problem. Yeah. So for anybody that has these symptoms, I have a questionnaire on the website that they can complete and get a score. If you get a higher than 38, and a lot of people are getting over 100, then you're very symptomatic for this, and you should see a binocular vision specialist. I was trying to see if you had done one on my website, but I don't think you had when we first did our consultation. Did you do that questionnaire at all with the other doctor, where you got a score at the end, a number?
No, I didn't do it with the other doctor, and I didn't do it with you because I remember I'm like, I cannot like literally look at the screen to like do the stupid, like I can't, cannot.
Okay, can you go on my website and do one? It's already going to be lower than it would have been.
Oh yeah, I'm definitely going to do one.
But just get something like get a baseline so you can track the improvement of it, because you forget, you don't remember how you felt a week ago or even yesterday, right?
Right.
So people have differences, but unless there's some kind of a numerical value to give them an idea of what it's like, they're not going to really pay attention to those changes. But when you're taking it and you get 100, and then you're wearing these glasses, and a month later you get a 50, you're like, oh my God, that's a huge drop. So yeah, I would suggest you do it too, so you can get a baseline for this moment and then track your progress over time.
Will do, and I'll add a link to that to the YouTube video. So thank you so much. This has been awesome.
This was fun. Thank you.
Thank you, and we'll chat soon.
It helps people. Take care. It's vividvisionsoptometry.com. They're asking what website it is.
Oh, okay, cool. Bye. Thank you.
Take care.